Hello, and how are you? My name is Winnie Barawa. Welcome to our session on lung cancer, and we are going to focus specifically on classification of the lung cancer. If you're new here, this is a channel that focuses on lessons, lectures, and expert interview regarding healthcare. And if this is an area that of interest you, kindly remember to subscribe. To just remind us before we go on, the lungs are two. We have the left and the right lung. And as per our picture here, the right lung has 3 lobes, while the left lung has 2 lobes. And in any of these places or in any of these lobes, we might have existence of the lung cancer or lung tumors. So in the classification, we will focus how the lung cancer appears or in which manner do they come out. So let's introduce it first. So lung cancer is one of the most common cause of death, both men and women. And tobacco use accounts for 80% of the lung cancer diagnosis that we have for the patient. Occurs mostly or primarily during the 5th and the 6th decade of life. That means it's very common for people who are in their 50s and 60 years of age. However, 70% of the lung cancer disease spreads to distant organs, and this includes areas like adrenal glands, kidneys, liver, and even the brain. And in the process of cancer spread to other areas, we call that process metastasis. So by definition, lung cancer is an uncontrolled growth of malignant cells in one or both lungs and the tracheobronchial trees. So where we have cases where the lung cells or abnormally grow in one or both of the lungs, including sometimes the tracheobronchial trees, then we have case of lung cancer. So this is basically proliferation of abnormal cells. In the proliferation of the abnormal cells, we end up having 3 stages of outcomes, whereby we say as the abnormal cells are dividing, they lead into a state we call hyperplasia. And hyperplasia is the abnormal increase in number of cells. That is, the cells are becoming very many, and this is what is expected, and this is not what is expected in that given place. While when these cells are increasing in number, they also present with abnormal size and shape that is different from what we normally have in the particular lung area, and therefore this state we call it dysplasia. And the last bit is the establishment of carcinoma in situ, where this abnormal number of abnormal number of cells in different sizes and shapes end up implanting themselves into the lung tissue. So the case where the lung cells or tissue or the lung cells or tumor has implanted itself into the lung tissue, we shall call that carcinoma in situ or the status of carcinoma in situ. So like we had described that the right lung has 3 lobes and the left lung has 2 lobes. In any of these areas of the lobes, we can end up with a lung cancer or a lung tumors. However, the tumors can occur also anywhere around our airways, all the way from the trachea, bronchioles, going down to both the primary, secondary, and the tertiary bronchioles to the terminal ends. We can have also tumors attaching there or growing. So lung cancer is classified into 2 main categories, where we have the small cell lung cancer, shortened as SCLC. So small cell lung cancer accounts for 20 to 25% of all the lung cancers. And the second classification of lung cancer is the non-small cell lung cancer, written as NSCLC. So non-small cell lung cancer, however, is the most common because it accounts for more than 80% of all the lung cancer diagnoses. And this non-small cell lung cancer comes in 3 areas or 3 types, where we have squamous cell cancer or squamous cell lung cancer, adenocarcinomas, and the large cell carcinomas. So in summary, we can say lung cancer is classified into two, small cell lung cancer and non-small cell lung cancer, where in the non-small cell lung cancer, we have squamous cell cancer, adenocarcinoma, and the large cell carcinomas. This classification most of the time comes out based on how the cancer is presenting itself, or how the lung cancer is presenting itself, and also where these tumors are located. For example, the small cell carcinomas, we are being told that they are mostly in the lobes, while the non-small cell carcinomas have a behavior of coming from the peripheral areas. But don't worry, we will describe this most in details, and then we will see what it means by having all these different types. So let's start with the first one, that is small cell lung cancer, SCLC. The small cell lung cancer, we say that this accounts for about 20 to 25% of all the lung cancer diagnoses, and it's the most aggressive of the lung cancer. So this is the cancer that when you're managing it and you find that it has started, majority of the time, it's advised that you start managing it with things like chemotherapy, because surgeries may not be as effective as we may expect, because this cancer is quite aggressive. So small cell lung cancer usually starts in the bronchi and then affects the whole lung. So as you can see here, this cancer has begun in the bronchial areas and it's starting to do entry into the lung tissues. The cells are small in this particular type of cancer. They're very aggressive with very large growth factors, meaning they grow very fast. So because they're small and aggressive and they have a lot of growth factors, they have the ability to grow very, very fast and spread to other areas of the lungs. So at time of diagnosis, we're being told, unfortunately, most of the small lung cancer, it has already metastatized to other parts of the body or to other parts of the lungs. So it's a type of cancer that's aggressive, meaning it divides very fast, and because of that, it also spreads very fast. So by the time you discover it, you find that it has a stage where it's already spreading and it has gone to other parts of the lungs, including other parts of the chest or the body. So it could metastasize to other areas like the brain, the liver, and even the bone marrows. So that's why I was saying that when you're managing the small cell lung cancer, sometimes you're advised to not just do surgery, but also begin with doing other treatments like chemotherapies. Then we have now the other second category, and that is the non-small cell lung cancer, NSCLC. So the non-small cell lung cancer accounts for 80% of the lung cancer, meaning it accounts for majority of this lung cancer. These ones grow and spreads a bit slowly compared to the small cell lung cancer, and it includes three subtypes. So we have here squamous cell cancer or squamous cell lung cancer, adenocarcinomas, and the large cell carcinomas. So for the classification, again, this is based on the location of these tumors and also how the state of spread and growth happens. So let's start with the squamous cell carcinomas in description. So squamous cell carcinoma is said to have moderate to poor differentiation, meaning the characteristics of the cancer cells is not as easily specialized compared to the other cancers, and it accounts for 30 to 40% of all the lung cancer. It basically tells you it's like majority of the lung cancers in terms of prevalence. It's very common in men compared to women. It occurs centrally in the large bronchus and then metastasizes slowly, meaning it metastasizes slowly but goes into the liver, it can spread to the adrenal glands, and it can spread to the lymphatic nodes. So in the squamous cell carcinomas, we are saying They occur centrally in the large bronchus here, and then they find their ways into allocating themselves into the lungs. So these ones have some kind of similarity with the small cell in terms of location. But remember, these are squamous, so you will find some differentiation, okay, in how the cells look like. They're associated with smoking, and they are not easily visualized on the x-rays. So when you're doing x-ray diagnosis, you want to check, you want to discover where they're located. You're being told that the squamous cell carcinoma cannot easily be visualized on an x-ray check. Then we have the second type of non-small cell carcinoma, and that is the adenocarcinoma. The adenocarcinoma is most common of all the lung cancers. 40 to 50% of all these lung cancers clearly have defined peripheral lesions, and they're highly metastasis, meaning they can spread very fast to other areas, including the liver, in the adrenals, in the brain. It's found in the peripheral areas of the lungs, like you find in the ends, in the edges, that is. For instance, here we have one spreading. So if you look at the location, the adenocarcinoma have some clearly defined peripheral lesions, but they're also famous around the peripheries. It can occur even in non-smokers, so that are people like passive smokers, and it can easily be visualized under chest X-ray. You can easily discover it and be able to locate it where it is in the chest under an X-ray. And the last class of non-small cell lung cancer is the large cell carcinoma. So this accounts to about 15 to 20% of all the lung cancers, and they tend to occur in any part of the lungs. However, they occur commonly in the peripheries of the lungs, invading the subsegmental bronchi, but also sometimes the larger airways. However, just remember they can happen anywhere on this lung. They have slow metastasis also, but they occur faster than the other. So compared to the other types of non-small lung cancer, the large cell lung cancer metastasizes very fast. So it can head to the kidney, it can head to the liver, and it can head also to the adrenal glands. So these are the various types that we've mentioned. Large cell carcinoma, which accounts for 10 to 20%. Squamous cell carcinoma accounts for 20 to 30%. Adenocarcinoma accounts to 40 to 50%, making it among the most common of non-small cell lung cancers. And the small cell carcinoma, which has small cells, commonly found in the heavy smokers. And this one, mostly said, starts in the bronchioles and can spread to other parts of the lungs. So in summary, we've mentioned that the cancer or lung cancer, this is abnormal division of cells in the lungs, most of the time genetically induced or has some genetic related risks, and it can be classified into two, that is small cell lung cancer and non-small cell lung cancer. In the non-small cell lung cancer, we have adenocarcinomas, squamous cell carcinomas, and the large cell carcinomas. So thank you so much for being with me in this particular class. If this is content that you really enjoy, kindly remember to subscribe, give us a comment of the word share, and also subscribe. Thank you so much, and see you in our next lessons. Bye.